Hey everybody, welcome, welcome. But we are just like right on time. Yay. My name is Brenda B. Bailey. This is the Theta Healing Power Hour. I always say you want to catch these because I know experts and influencers, and you're always going to learn something. So please make sure that you are liking, that you are commenting, sharing, and even tagging, because we're going to be speaking to a very specific market. But I think it's you again. We all benefit from learning from everybody. So this isn't like you're not going to get anything out of this. You're going to get a lot out of it. So I just, that reminder, finally here towards the end here, I'm remembering like to say this kind of things. And as always, my featured guest will then cue you towards the end on saying yes with doing some theta healing work, because some things will come up. You'll see me taking some notes so we can do a little work, because that's what I really love to show people, model to people, is that in conversations, we hear some things that maybe we need to change, and we could do it easily with theta healing, or just make us aware. So we're going to go ahead and get started now. So welcome, Dr. Michael Simmons. And I'm going to read your bio. So thank you so much for joining us.
Thank
so
you.
Let me tell y'all a little bit about Michael, right? As I've cut him off here as he's saying thank you. Go ahead, Michael. Sorry.
Thank you. Thanks for allowing me to be here, Brenda, and talk to your group. And thank you. I appreciate that.
Absolutely. So once again, this is social media, guys. So let's, share it with all our audiences and share it with whoever you feel like needs to hear this. So Dr. Michael has spent over 4 decades in healthcare and has run a successful private medical practice for the last 27 years in rural America. I don't think it's that rural, but again. So during that time, he has seen over 240,000 patients. However, after a life-changing accident a few years ago, he left clinical medicine to focus on empowering the disillusioned physician in creating a successful cash-based medical practice while reclaiming their health and relationships. This is what a lot of us have to look at and have a challenge. So medical doctors and people in the medical field they also have to look at this as well. So he has had opportunity to speak at the Harvard Club of Boston, Carnegie Hall, and AT&T, while sharing the stage with Michael Gerber, Suzanne Summers, and Martha Stewart. He has appeared on network television talking about the importance of physician health and well-being.
Thanks.
So Michael, thank you so much for joining us.
Thank you for that introduction. I appreciate that.
Absolutely. And I think this is the thing that also is really nice for people to hear and to be aware of, is that nobody is what's the right word? I'm at a loss for words today. Sorry, guys. We all have our own kryptonite. We all deal with the same things. It doesn't matter your level of education or experience. And we all have to eventually come around to looking at this. And it's where people find their niches, right? Is to know, this is my experience. This is what I went through, and I'm not the only one. So I'm on the other side, and I can help people with that as well. So we're going to go ahead and get started with questions for Dr. Michael here. So Dr. Michael, let me know, how has medicine changed in the time that you've been in medicine?
So I've been in medicine for 4 decades, and I've been in my own private practice. And when I started in medicine, our typical routine was the patient would come into the office and they would tell us what was going on, and we're trained to diagnose a problem and come up with a treatment plan and a diagnosis. So and most of those treatment plans involve medications, or they involve some additional procedure. But medicine has changed in that we've seen for physicians, the reimbursement for physicians has gone down year after year for a long time from the insurance companies. We see patients are getting more and more education. One of the things that we talk about is a lot of physicians will use, or a lot of patients will use Dr. Google, or they'll use the internet and their keyboard to figure out. So doctors have to stay on top of more. We've seen more information coming in from insurance companies, electronic medical records, government entities, administration. Private practice has almost gone away. When I started, nearly 70% of physicians were in private practice. It's now about 30%. Most of the physicians are now owned. It's contributing to a large amount of burnout for physicians and exhaustion. And especially in this last year, we've seen that on the rise.
I was actually just going to say, you're talking 40 years. I was going to say just in the last year. So again, we're not having any debate over COVID or pandemic or how the vaccine has been handled or rolled out. We're not touching any of those subjects. That's not why we're here. But it definitely, I'm guessing, has contributed to making it more difficult
Oh,
for doctors.
absolutely. Doctors have been working longer hours, and there's more pressure on the physicians that are working in the hospitals to meet the demands for the hospitals because they've seen sicker patients in the last year. And so there's more demand on them. Plus, they're concerned about their own illnesses and their own health. I've had colleagues of mine that would work in the hospital and go home and live in a trailer in their driveway because they couldn't see their kids because they're exposed to this COVID all day. That's contributed to an impact on their relationships, and it's contributed to an impact on their own health and their own isolation. And that's starting to become a problem in medicine.
Well, and this is the thing also too. And again, it's, I think people are frontline workers. Thank you. And we're all experiencing that separation and isolation. I think it's just been accelerated. These are things that I think happen all the time. And again, there are certain areas, certain professions that people choose, and they have that type of personality. Again, nobody becomes a doctor. And maybe some do, right? I'm not going to say no one becomes a doctor because they wanted to get rich, right? They became a doctor because they wanted to help people. They wanted to make a difference. And there's a whole lot of red tape, society, and again, all of us have had to up our game just because more information is out there. But I think people have different expectations for doctors.
Yeah.
They're human. They're
and
human.
I think you're right. It used to be the physicians were at the upper echelons of income in their communities. That's not the case anymore. Physicians are a lot like everybody else out there. They come out of school with large amounts of debt. So they deal with debt like everybody else is dealing with. They deal with the struggles of having enough money to meet their needs, okay, and the needs of their family. And then their time and their commitment to their work, because they want to make a difference for other people, they forget the one set of people they need to make a difference for. And that is the people that live in their own household. So many times you see the children of physicians are kind of doing their own thing, or the relationship is struggling at times because the physician's so focused on work.
We used to kiddingly say, one of the things that Michael and I share, right? As I probably share with his family, is that a lot of my family, my immediate family, has been in the medical profession. So what I found when I reached like my 20s and meeting other children of nurses, right? Because my mom's a retired nurse now, is that the joke is that you weren't allowed to get sick, right? Because she didn't have time for that. She was helping other sick people. And I think that, again, it can't be just nurses, and they're helping other people. Other professions fall into this, right? But again, we're talking about something that people put at a different, I think there's a double standard possibly, because we're talking doctors and we're talking about people's health.
Right. And doctors do get sick as well. And we're human. We have our own things that everybody else is going through. We have our own struggles around taking care of a house. We have our own struggles around our health. We have aging parents. We have, kids that, are going through high school and all the trauma that goes through high school. We're just like everybody else. We just have a profession that we chose to go into, in which we spend a majority of our time helping and serving other people. And sometimes in that dedication, we forget that we need to take care of ourselves first. And then we need to take care of our family. because only if we take care of ourselves and our family do we have enough to give to other people.
Absolutely. And the thing that I was also gonna just pipe in about is that, and now it's probably just like left my mind here immediately, is that because you're saying so many good things, right, guys? So again, if you know somebody, if you know a doctor, right, you might even be just meeting with your doctor saying, you know what, you might want to, you know, Google Dr. Michael Simmons, you might need this. But also tag, like, share, again, things that Dr. Michael, it's lovely to be able to be made aware of, but it also, can we relate to this? I think we can all relate to this. And I think also too, another big thing when we're talking, and again, not the only profession, that we're seeing the tremendous amount of student debt that comes in order to be able to be a medical professional, is back in the day, because Michael and I think we haven't like shared our exact ages, but I think we're pretty close in age, is that, you know, I know like from my uncle, his wife didn't work. She didn't have to. So she was able to handle that family side. She was be able to pick up the slack on the relationship. And now with the debt, it's like two people have to be working. And so it takes away from what you've historically seen. And you can correct me on that, Michael, but I think that that's also a contributor as well.
Well, you're exactly right, because I have friends of mine that have come out of medical school with with debt that is $300,000, $400,000 in debt. By the time they've finished their undergraduate school of 4 years, the medical school of 4 years, the residency, which is going to be another 3 to 10 years after that, they're coming out of debt before they ever start a practice, before they ever get into medicine and do their chosen career. There's $300,000 to $400,000 or more in debt. Now, you talk about something that will contribute to burnout when you're trying to pay off a house that's just debt. For some people, that's a lot. And we see that right now, 40 to 60% of physicians, based on the numbers, are burnout. So those physicians that you go in and see, 40 to 60% of them are already burnt out when they see you. So they're struggling at the same time that you're seeing them. In fact, one of the other statistics that shows up is the suicide rates of physicians is about 400 to 600 a year commit suicide because of the pressures in medicine. So we're not immune to pressure. Sometimes we don't necessarily deal with it because we don't feel like we have safe places to deal with it, but the suicide rates are high. And so self-care is really important for physicians to focus on. And the individual patients can actually help us do that by asking us, what are we doing to take care of ourselves? What are we doing to take care of our families? Because sometimes we don't do enough. And it's nice to know that patients want us to be taking care of ourselves and our families as well. So you can help us out.
I think that that's great. I love that suggestion. And I also think, you know, I think it's that thing as well, as that, you know, you come in to an appointment, there's been a lot of frustration, usually because of your insurance, just saying. And then you're wanting, you know, it's kind of like, you know, when you go to a restaurant and you hold the waiter responsible for how the cook made the meal. That's not you know, that's not the person that you need to be holding responsible. That's not the person that you need to be questioning. And yet then we come on, we're frustrated, or we've had to wait a long time for an appointment because, like Michael said, less practices out there. So then they're fully booked months, especially if they have a specialty, months in advance. And then, you know, then they have the same, the word that comes, and it's not the right word, it's anxiety, but they have the same pressures. Because if you can imagine, money pressure's huge. Money anxiety is huge. Debt is huge. It affects all of us, except that now you have an individual who's, you know, they're not just, and again, they're not just driving a car, right? They're not just taking a walk. They actually have human lives that are their responsibility. So they have to balance that or not, right? So they're human, they're doing the best they can. So then you're having to look at, and then we all know this, right? We've gone on WebMD or we've gone to Google and we have some information, which is great depending on how you roll it out to them, right? So I always, the joke for myself in growing up, because being raised with an uncle was a doctor, a father was a pharmaceutical salesman, a mother who was a nurse, is that I just always say, well, I don't wait for the questions. I'll say, this is what's going on. This is this, this is this, this is what I've taken in the past, and this has worked, this hasn't. And then I just kind of lay it on there and let them, and inevitably I always had to laugh because whoever I saw, because I traveled a lot, so it wasn't like I could always go see the same doctor always, is they would be like, so who in your family's in the medical profession? And I just would laugh and go, is that obvious? And I think that now with information that people have, it's that you're not asking questions, you're questioning, which of course we need to, but sometimes you just need to give information and listen.
Right. And that's true. I mean, when you think about what a physician is dealing with, and many people don't know this, if we're employed by a hospital, and the majority of physicians out there are now employed by a hospital, even though they may be in a practice, there are very few that are in practice by themselves or that are in private practices where they're responsible for everything, because the hospital with an administrator is actually dictating the physician what they can do and can't do. And they are pressured by numbers. The hospital sees numbers and the hospital sees dollars, and they expect the physician.
And they want to be a profitable business.
Right. The hospitals want to be profitable. And then they're dealing with the stuff that comes from Medicare, which is the government insurance for the older, and with Medicaid. So they're dealing with lower payments from them. So those insurance payments are also decreasing. So there's more pressure on the doctors to see more patients. And then we have what also plays in there is we have regulations and we have protocols that we have to follow, which are what are called standard of care. And it's difficult for us to deviate outside of that because of the regulatory system that actually controls what a physician can do. So even though we may think the physicians are independent, there's actually a lot of oversight over what we're able to do, both from an administrative standpoint, an employer standpoint, and a regulatory government standpoint. There's a lot of oversight over what we can do. So that's some of the pressure that leads for physicians. So,
and I think it's a great awareness. It's beautiful to have this because, again, with anybody, if we can understand where somebody's coming from, we can approach it differently. That gets to be a win-win, because your health, your care is not, again, I think that's also been a challenge in the past for doctors, is that nobody wants to take accountability. They just want to be fixed or saved.
That's true. That is true. I mean, for a physician, it's easier if somebody wants to be healthy. And we find that there are some people that want to be healthy, and there's a lot of people that simply want the next pill to fix the problem. And then all of a sudden we're giving you a pill to take care of the side effects of the other pill. And we make the comment that there's a pill for every ill out there. And so we may actually compound that. And so when patients will let us kind of work with our expertise and come up with a treatment plan that's based on our expertise, oftentimes we'll actually see some improvements in their care and minimize, hopefully, some of their medications.
Exactly. Because that's the thing, is that if you can allow somebody to do their job, they can actually get to the root of it instead of just putting out a fire on a symptom. And I think, again, this happens in many industries, but this, again, we're talking about our own health here. And I think that that's another thing that's really true as well when you're looking at making a profit. I know I had a wellness clinic many years ago, probably something that not everybody knows. And I had an amazing, a brilliant physician's assistant, way out of, how did I get this person? And brilliant. And her comment was, I do not like working for the hospitals because they don't let me get to know my patient. And I don't like being told that I can only spend 15 minutes when I may need to have a 30-minute conversation to figure out what's going on and to make a recommendation. And again, here's an awareness for y'all that allows us to be able to have some compassion on what's going on. But unfortunately, it's a system, right? And so here's my next question for Dr. Michael is, what do you see needs to change in the future for medicine?
I think medicine right now, the way medicine is, it's very much disease focus and disease management focus. So what happens for the individual patient is you come into us and we're actually, as physicians, we're helping you to live with your disease. That is starting to overwhelm the physicians and it's starting to overwhelm the system. I think what really needs to happen is a more health-focused patient care as opposed to disease management care, and focusing on health and those lifestyle issues. And when physicians can really get into education, that's going to be key, is that it's a collaborative agreement and an arrangement between the physician and the patient. And when we can start talking about lifestyle, what is it that you put in your mouth is actually having an impact. There's been a saying around for a long time that food is your medicine, and medicine, you do not want medicine to be your food, but that's kind of where it is now. But actually the foods that you have an impact on how you feel. Think about Thanksgiving dinner. You eat turkey and then what happens? You're tired afterward. Foods can make you anxious. Foods can make you depressed, especially those processed or those fried or those fast foods. They can impact your mental health. But the other thing is thinking about how you move. Are you getting outside and you exercising every day? I heard it said that we're like a plant. We need sunshine and water. And we don't get enough of either when we're in these closed spaces, especially in the isolation in the last year, where we're not getting enough sunshine. We're not getting out into nature and we're not around other people. We're social creatures, so our relationships are important. And so we have to pay attention to the people that we communicate with and what we take in from them. We've all known where we stood beside somebody that really feels it doesn't really feel comfortable. That's energy. You're actually feeling and getting their energy. That energy has an impact for you and for all of us on how we're going to feel. And then sleep, we got to sleep. So if we're really focused on our lifestyle, those things that are nutrition, exercise, sleep, our relationships, and the big one is stress, because all of us are chasing that green piece of paper. We call it money, but everybody's chasing it. And that causes a lot of stress for people. But it's how do they deal with the stress of just everyday life? Like, what am I going to wear to work today? Or what am I going to work on? If I'm at home, what am I going to work on today? Those are things that have to be dealt with. And when patients are actually working with their physicians to focus on their health, as opposed to simply disease management, then we can actually improve people's health, not only for the individual, but the community. So I think healthcare has got to change. It's got to be less medical focused, more health focused, and realize we need both physicians in both of those areas. So I'm not saying that you don't need the disease management, because we do, but we also need the health focus. So those physicians, and there's a specialty that does that focuses really on health.
And another, what you were saying, which is brilliant, and it's also making people aware, but also too, in this day and age, with just everything that's going on, you're seeing things pop up that were never around before, like food allergies. I mean, and a lot of allergies in particular, and asthma and different types of things. I mean, they've been around, but you see it so much more now, and also in a bigger way. And I feel like this is my own thing. So many things are stress related. So many things are stress related that make people be more sensitive. And I know I figured that out for myself because I've always suffered from seasonal allergies. But once I had cleared a lot of things for myself, I realized like I hadn't taken an antihistamine in 6 months, and I noticed that I need to take one when I've had a lot of stress.
Yeah.
Allergy problems.
And that is true. And one of the biggest things that causes people stress these day and age is this. This thing is causing so much stress for people, because how many times does it ding and you look at it? Oh, do I need to respond to that message? Or I'm looking at the news, or I'm looking at my kids' stuff, or I'm looking at all kinds of stuff, on our cell phones. And those things are causing stress. Even just the cell phone itself causes physical stress for us.
Well, and I also think too, to piggyback on that, it's that it is a time drain as well. And we can have a lot of things, but we all only have 24 hours in a day, and it depends on how you do it. And I think that people get sucked in. Now, I think that also people things are changing for people and they're having different, like I even just rearranged my desk here recently and how I did it so that I do not have access to my computer. I only have access to it when I sit at my desk. And I've had to change some things and it's been great. Like I'll say that, but it's like a little like, and I've just had to let it go. And I've really had to become fierce with that because I heard somebody say this and I've been saying it a lot. I've been requoting it. It's not that people are working from home. It's that they're living at work.
Yes.
And
And
when that really truly sinks in,
that is so true, because so many people have either turned their living room into a working space. Physicians have done it when they're in doing telemedicine. They've turned their living space into a working space when they're working from home doing telehealth and telemedicine, which some of them are. But we've now made it so that the home is not an escape and a castle and a fortress to protect us from all the stressors out there. We've actually now invited all of those stressors into our house, but they're not just my stressors. They're my spouse's stressors that she's invited in. My kids invited in their stressors. Everybody's inviting in the stressors. And all of a sudden that energy starts to have an impact. You know, those stressors have an impact. My kids' stressors, they have an impact on me, you know, when they're bringing them from outside.
my dog is talking to me and I'm like, so sorry, Michael. I meant to like, I was
No
like
worries.
trying to mute again, real life, hashtag real life here. And so we have animals and children, right, that somehow just come in and kind of take that deal. But it's so true. And then also to compact that also, or impact, whatever word you want to use, and not going out as much, and then depending on where you live, not being able to go out as much, and then having to supplement the vitamin D that you're not producing, right? Because that's also one, not just a part of health, but that's also a part of prevention from COVID. You know, if you don't realize that, let me just tell you that vitamin D3 with K2, good combo to help in being healthier and having more immunity when it comes to COVID. So, it's all of those things. They all go so hand in hand. And it is so true in everything that we're talking about, as far as it's the same thing, again, not to minimize, but there are so many professions out there, including doctors, especially doctors, including the medical profession, that it's just escalated their stress because of how they're having to adjust to be able to support people and their patients.
And you're right. The stress levels are going up. But we have not developed really great stress reducing activities. Now, granted, our stress is not going to go away. It can go up and down. Stress is not going away, but how we as individuals deal with the stress can actually have an impact on our relationships and our health, but they can actually have an impact on our money, which is one of our major stressors. They can have an impact on our money. Dealing with a mom or a dad's stress can have an impact on a child's performance in school. So dealing and having a strategy for dealing with our own stress as it goes up and down is actually key, not only to your own health, to the physician's health, but it's also key to the health of everybody that they come in contact with. And the health of those people is also key to everybody that they come in contact with. So my attention, or your attention, to how you deal with stress has an impact on everybody that's listening to this. And that has an impact on everybody that you will meet today. So we're not isolated. We like to think, oh, I'm dealing with my stress well. Well, I can tell you from my own personal experience, your body will tell you when you need to stop.
Absolutely. And I think that that's a thing also too, in the last year, that we've become aware of. I think one, I was like in a group and they were asking like what people had learned, and people were talking about how they realized, like, in that physical action, how much time they have wasted prior to 2020. and how they will adjust it now, as things start to open up and as things are people are starting to go back to some things that they haven't done for the last, 16 months or, 14 months or however long it's been. And I think that also too, it's being able to separate that and having what you can do, where you're at, how you're, and that's the deal. It's like, how do I deal with my stress? What I feel like the pandemic did for people is to realize that we had a Band-Aid, many, and that it needed to shift and the beautiful thing is it was kind of forced on you. And then now you're going to be able to go forward and be able to do it differently. I think that so many people are like, I can't wait to go back to normal. It's like, do you really want to go back to normal?
Well, and that's the question is we talk about going back to normal, but what is normal? Because normal has shifted. The normal way that we engage with each other has shifted. We spend so much time on meetings that are virtual. Speaking with somebody virtually is not the same as sitting in the same room. So how we deal and meet with people has changed. How we do business has changed. How people get healthcare has changed. What was normal before is not there anymore. So we're actually in this space now of discovering what is the new normal. And so it's different for everybody. And so those things are adding stress is because it's that exploration of what is it that's going to make an impact? What's going to be normal for me in the future may not be normal for you in the future.
Absolutely. And I think that this is also another thing, just here's food for thought type deal, is that like what I've noticed about me is that I'm busier. I'm just busier. 2020 was a great year for me. I've been very busy. And since I'm not traveling, and since I'm not having to get in a car, I am on Zoom more. And there is such a thing as Zoom fatigue. And I am just pleased as punch, right? I'm so happy when somebody says, can we just do a phone call? It's like, oh God, what is that? I haven't done a phone call in forever, unless it's like to my mom or something. But as far as business related, it's all been video conferencing. And that is also exhausting in its own way, but for different reasons. But I know I've had to get a better handle just for myself on my schedule, because I feel like I have all this time now. And it's like, okay, well, don't fill it all with Zooms. Just saying.
And that is so key for a lot of people, even for physicians. It's like, you've got to do your own self-care first. You got to take care of your own mental and physical health, because it is so easy to say, oh, I'm going to jump onto this 15-minute Zoom call, or I'm going to jump on this 30-minute Zoom call. And everybody's got a webinar out there, and there's a podcast to listen to, and there's all of this stuff. And so we've got a ton of information that's flooding us more so than what we've ever had. And it's really important for us to take care of ourselves. And so that time that it's like, turn off the cell phone. In fact, sometimes we say, if you're working at home, put the cell phone in the other room, because every time it dings, it's so tempting to go look at it. Put the cell phone in the other room. Don't put it by your bed, because it's so easy, because now business happens around the globe. So I may be sleeping, but somebody that I'm working with is, it's 2:00 in the morning for me, but it's only 11:00 in the morning for them. So, there's a big time difference. So they're trying to communicate when they can communicate. You've got to shut that down. You've got to do your exercise, because the thing is, nobody's going to care about your health until you do. Nobody's going to care. The physicians are not going to care about your health until you do. And nobody's going to care about the physician until the physician does. And if the physician is not well, if the physician is stressed, it's going to have an impact, and it's going to be a limit on how well the patients that they're taking care of can be.
So, Michael, is there anything else that you want to add to how physicians and patients can receive the best care? Because I know we've thrown a lot of things out.
Yes, we've thrown a lot of things out. So there is a field of study called functional medicine, where physicians are focusing on root cause. Okay. That's one area that people could start looking at, being empowered around their own health. But moving into a cash-based model, which is what I educate physicians to do, it allows the physicians to actually work and spend more time with you, as opposed to what insurance is dictating. So realizing there are clinics that are called direct primary care clinics. Those are physicians you pay a membership fee for. That's a great way to actually optimize how you can get healthcare. Okay. Another way is realizing that you're going to spend money on yourself medically, either now when you're young and you have the money, or you're going to spend it on prescriptions when you have the diseases and you get older and the money is limited. So taking a focus that says, I'm going to focus on my health now, and I'm going to work with a physician that is focused on health. And we train them to do that. We help physicians to figure out how to not be so focused on medical management, how to focus more on health. And they can focus on both when we need it. So I think that's really key, is to be willing to invest in yourselves and invest in your health instead of waiting for somebody else to pay for it. Now, when I think about insurance, my auto insurance pays for an accident when something goes bad with my car. They're not paying for me, my oil change or my tire change, or for me to maintain it. They will pay when there's a disaster. You know, I have an accident or somebody hits me. Your health insurance is not really designed to pay to keep you healthy. It's actually designed to pay for your medical expense when you have health that fails. So being proactive about your health instead of waiting and asking questions is going to be key for people getting healthy. And it's actually going to be key for helping physicians so that they're not so burnt out and not so tired, so they can actually focus on what they're trained to do.
Well, and it's either pay now or pay later. And how do you want to pay for it? So that's huge. And I think that everybody ends up having a wake up call. And so I'm guessing, you know, what was yours, Michael? How did this come about for you, Dr. Michael, as far as caring about creating the program that you have, caring about other physicians?
Well, it's interesting because, like I said, I've been in practice for 27 years. I've had my own issues. I've had a couple strokes because I was overworked. I had a couple strokes and I was told I wouldn't walk again, was able to get out of a wheelchair using this functional medicine model, health approach model. But I had a major injury that took me out of healthcare, providing clinical care. In December of 2018, I'd been active and I had a fall when I was on a vacation in Mexico, broken arm, came back to the United States to have my surgery and woke up as a quadriplegic. And so I woke up unable to move anything, but totally aware of everything. And what I realized when I was laying there is I didn't want to ruin my kids' lives by having to take care of a body that didn't work when my mind still did. And so I was thinking, as they were doing tests on me, how do I get out of this? And then I realized late in the night that I'm not getting out of this that easy. And so I had to realize that I had to pull my internal resources to make a change. And as I laid there in bed, it was simply move one finger, take one step, move one finger, and then move the next finger, and then move the next finger. So after about a week of that, I was able to leave the hospital, but I was able to move part of my upper body, but unable to move my legs. I was unable to walk on my own. I ended up closing my practice because I'd had 4 clinics and I wasn't able to get to them. I spent the next 20 months learning how to walk again. And during that time is when I started realizing physicians are not healthy. Physicians have medical issues. They have relationship struggles. I've had the burnout. I've had the exhaustion. I've had the relationship issues. Physicians have those just like everybody else. We're human. And so what I realized is I needed to develop a program and I focus on physicians' health and their relationships. And then it broadened with the last year to how do we focus and help them stay in medicine? Because we don't need the older doctors that have all this wisdom leaving medicine too early because they can't impart that wisdom onto the younger physicians that are coming in. So we needed them to stay in practice. And so that brought about my thought to focus on helping these disillusioned, disenfranchised, disengaged physicians build a profitable cash-based medical practice, independent of the hospitals, independent of insurance, that focuses on educating people around health and health promotion, but also The unique thing of that is they can also manage the disease processes as well. So they got both of those, the health and the disease, they can manage both. And then we come back in and we focus on the physician's health and that of their significant other. And then we focus on those relationships that are important, because if the physician's struggling with their own health, their own relationships, if they're struggling with their finances and they're struggling with debt, all those things are adding to stress, and it has an impact on everybody else's health.
Well, and I think it's, I know that this interview is a little bit different than other ones. And I think it's just to kind of put the shoe on the other foot and to realize that, again, sometimes it's nice to hear I'm not the only one. And even doctors go through this as well. And it's also to make you aware so that you can be empowered and more proactive on your health as well as your medical care and how you want it to look. And I think it's that thing also too, where people are like, well, I want my insurance to cover all of this. Well, in a great utopian society, that would be lovely. But this is the thing, you have to make some choices and you have to decide. And that's where I've seen, because I've been around the holistic community for about 30 years. And so I've seen people, the naturopaths, the nutritionists, the other holistic type chiropractor, everybody else that they're looking at going, well, we can help you with this, we can do this, this will help this. And people have benefited from it because that's actually been around. A lot of it has been around as long as, or longer probably than some aspects of medicine. So, and for myself, even just having taken anatomy and physiology, which I had to take because I thought I wanted to be an acupuncturist and thought I was going to do that. The body is just amazing. And it is intended to heal itself if we can support it in that. And spoiler alert, most prescriptions are not going to do that for you, which is what Dr. Michael's been talking about, as far as you have to look at your actions, your behaviors, your routines in order to be able to support that. I know for myself, a lot of people always say to me, Brenda, you're so positive, you're so happy. Well, guys, I'm going to here's another thing, let you get behind. I haven't watched the news in over 25 years. I just don't. And it used to drive an ex-boyfriend really crazy because he would always be like, how can you? But I'd be like, I can do that. I'm really okay with that. And if it's something big that I need to know about, I will find out about it. I don't need to watch the news on a daily basis to be able to do that. I turn the ringer off on my phone. It's off, even during business hours. It's off because I'll come to it. Now it happens to be hooked to my new computer. So that'll come up, it'll ding, but I don't always check the ding. And I know that because there are just certain things in order. So these are things that I've done. And I think probably the biggest thing has been exercise and figuring out, like, I don't want to go to a gym right now. What am I going to do? And I joined for myself, joined a smaller studio. And then that didn't feel very safe. So then so it's kind of going back and forth. So it's been hit or miss for a lot of us as far as how we can support ourselves, but that's life.
And you're very true about that. I mean, we have to develop means of supporting ourselves. And one of the things that I've always said is illness starts with an I. So our illnesses happen in isolation. And what have we done for the last year? We've isolated ourselves, either by choice or by mandate, but we've isolated ourselves. So we've seen an increase in our illness for mental health and all those type of things. Wellness starts with a we. Wellness happens in our communities. That's why it's important to join a gym. That's why it's important to have girlfriends. That's why it's important to actually do stuff together. That's why our relationships are important, because that's where our health is going to come from. And you're right. Everything is changing. Okay. And you think about, when you're talking about insurance, if any of us waited until insurance was going to pay for something for our cars, we would have bald tires, windshield wipers that wouldn't allow us to see. We would have headlights that are dim. Okay. The engines would lock up and get destroyed because we would not be putting oil in them or doing our oil changes. we would have all kinds of problems with our car. And it's kind of the same thing with us. If we don't want to invest in ourselves, expect to have problems and expect to pay for them, because it's more expensive to pay for a new engine or a new car than to simply pay for an oil change. And so paying for your health and being proactive about going in and getting it when it needs it is going to be important. And it's important for physicians to realize that they've got to do the same thing. Physicians have to focus on their own self-care. They have to be able to say no to a hospital administrator, because like you said, looking at the news, what I take in is not just what I put in my mouth, but what I see with my eyes and what I hear with my ears is going to have an impact on my health. You know, so if we spend all of our time checking the news where they play things over and over and over and over and ad nauseum, we're going to have problems with mental health. We get depressed when we think about things from the past. Our depression is associated with things that we wish we could have done different in the past. And our anxiety is really associated with a future that has not happened yet. And if we can actually focus on changing and altering our future to what we want, what we choose, and what we say, as opposed to what's dictated to us, we can actually reduce the amount of anxiety by being in control. It's kind of like driving a car. Now, I can be like, take advantage of Tesla, the electric car with the autopilot, and it may veer off the side of the road and it may have an accident and a total disaster because I didn't have my hands on the wheel. If I have my hands on the wheel of my health and on the hands of the wheel of my relationships and my life, I get to tell it where it's going to go. If I want to go to the park, I drive to the park. If I want to drive to health, I drive to health. I don't run away from disease and illness. I drive towards something that I want instead of running away from something I don't want. What do you want?
Well, and I think that that's also, and we're going to do a little theta healing work around everything that Dr. Michael's been talking about, as well as what I've just been picking up, like would be nice. But, that's the thing too. It's, the information that's out there, how the news operates, is that we want to instill fear. And so it's not good to be in fear all the time. It's not good. We don't make good decisions when we're in fear. We don't. And it's not good for that, your adrenaline. It's not good for what your body's producing as well. So, and that's the thing too. It's what we hear, it's what we see, it's what we ingest. It's also what we feel. So the energy of things that are out there and what's going on. And of course, we all know that I love to work with energy and change that and shift that for people on a cellular level, but it's also to empower people to be able to do what they need to do for themselves, to be able to have things that are different, to objectively approach things instead of reacting. These are all things that make a huge difference. Exactly. And real life here, Chula wants to get in on the discussion here. I'm like, okay, come over here. But again, I could be stressed about it, or it can just be what it is, right? And exactly. She gets to just be in it. It's like, it's not a big deal. This is not a motion picture here that's costing millions of dollars. This is a Facebook Live with Dr. Michael. It's going to be okay. I was saying I had a 5-day event, Dr. Michael, where my cat just decided, has never done this, and just like pulled down the whole green screen. And I had to laugh, and I was like, one moment, please. And I had to turn off the camera and get it. It's like, what are you going to do? It just is. So it's really okay. And I think that that's so important with everything that we do, is just to have a level of forgiveness. Exactly. Maybe you haven't done it right. Maybe you weren't aware of it. Maybe you just hadn't been taught that, or you hadn't had it modeled, or whatever that is. So yes, we can blame somebody else, or we can just say, well, that was then and this is now. And how do I want it to be different? How is it? I've learned a lot of things energetically, which of course helps me and what I do for a living, just in this last year, that I wasn't aware of, and probably wouldn't, or it would have taken me a longer time to become aware of it had I not had this situation. So we can all look at what we've gone through and being a quadriplegic, and again, beautiful, some work that we're going to do as far as contributing to that, then just move one finger. I'm not saying, what is it that, again, I always say that that's like the biggest reason, Dr. Michael, that people don't start moving forward, even in their businesses, because they want to know how it's going to end. They want to know the end. And it's like, you know what? All you need to do is the next step.
Exactly.
All you need to do is just move the one finger. I mean, that was a beautiful, and I think all of these car insurance analogies are amazing, because I think it kind of makes you think, like, I hadn't really thought about that. I hadn't really thought about it like that. And I think that it's a unfortunate deal that as human beings, we just are kind of used to, making us somebody else's responsibility.
Right. Exactly.
Whether it be medical or whatever area. I think a lot of things are coming to light for us that we're just like, oh,
Exactly.
I was in this illusion of this not perfect world, but of that it was done differently. And a lot of it is because people have been too quick to give away their personal power,
Right.
and their intelligence on making a decision, or saying, again, there's a fine line between asking questions and being questioning. We're also going to do that work. I mean, there are just so many things that if we have the discernment, it just makes it so much better.
Exactly.
So we're going to do a little theta healing. I've made my little list. So again, theta healing, it goes beyond the brain, the conscious, the subconscious mind. It makes changes on a cellular level. So most of the information that's out there is just change how you think, and it'll change how you believe. And you can do it that way, but do you have time? Most people don't, or the energy. This just makes it quicker. It's more efficient. That's kind of my perspective on what I like to see. So we need to forgive ourselves, right? So we're going to go ahead and let's also just make sure we have those basic beliefs in place that I always like to do with a new client or student. So Dr. Michael will cue you on when to say yes, guys. So just be paying attention. So we want to change. I want an instant healing. I deserve an instant healing. An instant healing is possible. And it's possible for Theta Healing to work for me with grace and ease. So if you would like those 4 basic beliefs, again, you have to say yes out loud and yes in the comments, because this is social media. So we're saying yes out loud and yes in the comments, but that lets our brain know, our divine power, whoever that is, the universe, that, yeah, we want that. So if you would like those, just say yes out loud.
Yes.
Cue Michael.
Yes.
So let's forgive ourselves for the mistakes that we've made, possibly in our profession, and how it has affected our relationships, how it's affected our children, our families, how it has affected our ability to do our job. And you don't have to type, Michael. You can just say yes out loud.
Okay,
Michael is good at following instructions.
Yeah, follow instructions.
So let me tell you. But being the featured guest here, you could just say it out loud to just have everybody else do it. That's why I was like, what's taking him so long to say yes? But then I realized he typed as well. So follow his lead on being a good following good direction. And then we also want to forgive ourselves for putting others' needs and wants ahead of ourselves. We want to forgive ourselves for not making our self-care a priority. So if you would like those, just say yes out loud.
Yes.
Let's also change the obligation, which means there's no choice, to have double standards. So whether that's because I'm a physician or because I am a parent, however that is, that you're thinking, oh, well, that's for other people, not me. Let's change what prevents us from implementing our own self-care. let's also allow ourselves to know the difference between questions and questioning, and have the discernment, super important, of when to question and when to be questioning. Let's get that divine definition of lifestyle. Let's change the obligation to chase money, because money is just energy, and you have to be able to attract it. And when we can clear things like this, that's the key. We'll do this round and then we'll have one more round. So if you would like those, just say yes out loud.
Yeah. Yes.
£6 gets heavy when you're holding it in your arms. I'm just saying. had to change arms. So let's also change what prevents us from having that awareness and separating from our stressors, from what causes us stress. Let's change what prevents us from lowering our tipping point. So again, we get stressed and our tipping point gets higher and higher. So we get pushed over the edge quicker and faster. So we want to lower our tipping points. We want to change what prevents that from happening. And then we also want to change and get those divine definitions and have the discernment between illness versus wellness, and what prevents us from approaching it from a wellness perspective. And then last thing is, let's change what prevents us from just starting with one little thing, whether that's for our health, for our relationships, for our work, for our recovery, whatever that is. So if you would like those, just say yes out loud.
Yes.
So, Michael, I know that you have a free gift. And again, is this just for physicians, or can somebody else who's not a physician get it, possibly pass it on to their physician, or what does that look like?
Yes. I have a book, or I have a ebook. It's called The Successful Physician's Guide, The Key to Having It All. And it's actually good information for everybody out there to what they can do and how can they have everything that they want in life. There's nothing that's kept from us. It's only whether we're going to go out and claim it. And that's what this book talks about, is how can you claim everything that you want. So it's a Successful Physician's Guide. It's the key to having it all.
And and I have that in the post, guys, just so you know, but go ahead and tell them, if you can tell them what the URL is.
Yeah. So my personal website, where you can find that and you can find access to my group and all my social media, is at www.simmons, SIMMONS 360.com. Again, that's simmons360.com. There's also ways for physicians and people to get in touch with me, contact information, all of that.
Great. Good. So again, like, share, comment. What did you become aware of by listening to this? Who would you like to share this with so that they can get benefit from it as well? So, Dr. Michael Simmons, thank you so much for joining us.
Thank you for having me on today, and thank you for allowing me to speak and to share my story. It's been great. I think for the people that are listening, realize it is all out there for you. It's all held by you, and it's just waiting, but you have to ask for it.
And first comes awareness, then comes the asking. So, exactly. We hope that awareness comes so that you can do it. So, we are, again, it's same time, same place, always for the Theta Power Hour. My guest next week is Susan Trumpler, and we are going to be talking about the 3 shifts necessary to get to yes and have fun doing it. So we will see y'all next week. And once again, Dr. Michael, thank you so much for joining me.
Thank you. Thank you.